Hi, my name is Stephanie Smith. I'm a nurse at Midwestern Nurse Practitioner Program. This is our musculoskeletal exam. This is Amy. She's my patient. She signed a consent. We've washed her hands. We've checked her vital signs, and so we're going to get started. We're going to start with her hands. We're going to inspect them first. We're going to check both the palmar side and the dorsal side. We're looking for redness, swelling, inflammation. I don't see any. They're nice and dry and pink. So we're going to palpate. We're going to start at the radial and the ulnar heads. We're going to go down through the metacarpals, and we're going to go to the proximal and the distal joint of each finger. Do you feel any pain? No. Checking for nodules, arthritis, any of that. We're going to do this hand also. We're going to palpate down through all the joints of each finger, the proximal, the distal. They're all nice and straight. Any pain? No. Okay. So we're going to do some range of motion. We're going to start with the fingers. We're going to do flexion, extension, abduction, adduction. We're going to do the wrist. We're going to do extension, flexion, abduction, adduction. Okay. Then we're going to go ahead and check on her hand. We have some tests for carpal tunnel. We're going to do the first one. I'm going to have her hyperextend her hand, and we're going to percuss or tap on the median nerve right here. Checking for if it causes any pain. None is tingling. Do the same over here. Okay. No? Okay. We're going to do the compression test. We're going to press right there in the groove, about halfway between the median nerve area. Anything? No, Mr. Tingling? No, Mr. Tingling there? Okay. We're going to do the Phalanx test, which is a prayer test. We're going to have her press her wrists together. We're going to do this for 30 seconds. Any tingling, numbness, pain. You can also do the reverse prayer test where you put her wrists together and she presses this direction for 30 seconds. Any pain, numbness? No? Okay. So the other test we're going to do the snuff box test, which is for either scaphoid or a navicular fracture. Extend your thumb out this way. And in the groove right here, we're going to press. Feel any pain right there? Okay. We're going to do it over here. In the little groove right here, we're going to press the base of the thumb. You feel any pain there? No. Okay. Then we're going to do the Finkelstein test. You're going to tuck your thumb, make a fist, and then I'm just going to extend right here. And we're checking for tendonitis. Feel anything right there? Any pain? We'll do it on this side also. Any pain? No. No? Okay. Alrighty, so that's the hand. We're going to do the Allen's test. We're going to have her make a fist. This is what you do if you're going to do ABGs. You have to make sure they have good circulation on both sides in case there's swelling or anything after you draw. So we're going to press both the radial and the ulnar artery. Open your fist. And it's nice and blanched. I'm going to let go of the ulnar side. And it's pinkening back up. So I'm going to have her make the fist again. I'm going to compress again. Have her open it up. And it is blanched. I'm going to let go of the radial artery, and it is pinking up nicely there. So we're going to do it on this hand also. Open your hand. It's blanched. I'm going to let go of the radial side. It pinkens up. So make a fist. And press again. Open it. It's nice and blanched. So we're going to do the ulnar side this time, and it pinkens back up. I think that's the test on the hands. So then we're going to check the elbows. Looking on process right here, make sure it's nice and pointed. We're going to check our epicondyles on the ulnar and radial right there. Do this side. Check any pain or anything right there. Okay. So we're going to do flexion, and extension, and then we're going to do pronation and supination. Okay. All right. So now we're going to move up to the neck. We're going to make sure her trachea is midline. We're going to inspect it. Palpate, and then we're going to do some range of motion. So we're going to extend, flexion. We're going to do ear to shoulder, and ear to the other shoulder. Any problems? No? Okay. So then we're going to come here to her suprasternal notch. We're going to palpate it. We're going to come out here along the clavicular line here to her acromial process, and then we're going to find her AC joint. And then we're going to drop down here to the coracoid area, and then to the lesser cervical and then out to the greater cervical. She has a bicep groove right here. Any pain or anything there? Okay. Her shoulders are nice and level. They don't drop. Shrug her shoulders. And she can shrug her shoulders. So we're going to do the speeds test. Put your hands up like this. Press down there. Does that cause any bicep pain? No? Okay. We're going to go ahead and do some range of motion. We're going to do flexion. We're going to do extension. We're going to do abduction. And then adduction, which is cross arm. We're going to do the scratch test. We're going to have her go over. We're going to check the distance there. And then we're going to have her do the other arm. And check it there, and it's equal. We're going to do a few tests to make sure that her rotator cuff is, if it's not torn or she's having any pain. So we're going to do the Hawkins. We're going to bring it up this way, and then we're going to overextend it that way. Do you feel any pain? And then we're going to do the apprehension test, which is like a thrower's arm, and we're going to overextend it that way. Any pain? No? Okay. And then we're going to do it on this side. Bring it up, Hawkins. We're going to overextend it this way. No pain? Then we're going to do the thrower's arm. We're going to overextend it that way. Okay. We're going to do the Nears test. I'm going to put my hand on her scapula, and then we're going to turn it this way, and I'm going to passively raise it. Okay. Yep. Okay. Do it this side. Like I said, here. Raise it that way. Okay. Nope. Okay. We're going to do range of motion already on your shoulders. We're going to do the flexion. Okay. We're going to do the drop test. We're going to raise your arms. Then we're going to lower them slowly to make sure she doesn't drop them suddenly. And that looks okay. And so from there, we're going to look at her spine. We're going to have her stand up. I'm going to look at her spine. The first thing I'm going to do is I'm going to check to make sure that she has the S shape where it's concave, convex, and concave here, which hers is. I'm going to start at the C7, and I'm going to palpate each vertebrae. Any pain or anything? No. All the way down. Make sure there's no indentations. I'm going to palpate the paravertebral muscle on either side. Anything? No. No? Okay. All right. I'm going to have Amy bend over, flexion, and while she's bent over, I'm going to check her spine, make sure it's straight, no curvature. I'm going to look at her hips, make sure they're level. Okay, I'm going to have her stand up. Now I'm going to have her bend back for some extension. Okay. And then I'm going to have you turn this way. Okay. And I'm going to have you bend to one side, maybe bend to the other. Then I'm going to have you twist and twist to this side. Okay. No pain or anything? Mm-hmm. Okay. And while she's standing, we're going to go ahead and do for the hip and the legs, we're going to go ahead and do flexion, extension, adduction, and abduction. We're going to do the same here, flexion, extension. We're going to do abduction and adduction. Okay, no problems there. So we're going to sit down, and we're going to look at her knees. Just inspect them, make sure they are they look the same on both sides. There's no swelling. We're going to feel them. Epicondyle, condyle. Feel the grooves on either side. Here. Go ahead and press out. Press out. Okay. So we're going to have her extend it, or flexion, and then extend it back if you can. And then same with the other one. And extend it back. Okay. So then we're going to go ahead and lay down. We're going to look at her hip. We're going to the greater trochanter to the ischial tuberosity. We're going to up here to the sciatic notch. Any pain there? No. Okay. So we're going to roll over the other way. And we're going to do that again. We're going to feel the greater trochanter here to the ischial tuberosity, and then the sciatic. Okay. Making sure they're level. We're going to do the straight leg test. We're going to we'll start with this leg. We're going to passively raise it. Okay. 30 degrees. Okay. All right. So I think that's it on the hips. So we're going to go back to the knee now, and we're going to do the allotment test, which we're going to press on the patella. We're looking for a small effusion. We're going to do the balloon test, which we're going to milk this down here. Test that. And we're going to look on the lateral side to see if there's any effusion there. There's none there. Shouldn't have any. We're going to extend it here. I'm going to do the drawer test. I'm going to sit on the bed here. I'm going to put the hands here, put it here, and I'm going to push against it. And I'm going to pull this way for the posterior and anterior ACL. I'm going to go ahead and feel the fossa back here, posterior fossa, and make sure there's no Baker cyst. We're going to come over here, do the same thing, sit here, here, and posterior fossa on either side, and we're going to push against her. And we're going to pull this way. We're going to see if there's any give or if it's lax at all. And of course, it doesn't have any. We're going to do the varius and valgus. For the MCL, we're going in the LCL, we're going to do the valgus, which is lateral, or it's for the medial. I'm going to put it out here to the lateral. And we're going to do the varius, which is this way. Anything? We'll do the same thing here. Valgus. No? I think. Okay. We're going to, let's look more. Look this way. We'll do this. We're going to feel the hip here. And extend it and rotate it out. Feel for any pops or clicks. Rotate it out. Pops or clicks. Okay. We're going to, for patellar syndrome, we're going to see the patellar here. We're going to move it to, push it up and to one side. I'm going to tighten your quad and make sure it tracks back in alignment. And we're going to do the same here. Actually, push the patellar up, now this way, and tighten your quad. Okay, make sure it tracks that way. The Lockman test also tests for that, where you just press this to see if there's any give. Also, okay. I think that's it. On the and then, so we're going to look at her ankles. We're going to come down to her feet. We're going to check the medial and the lateral malleolus on both sides and make sure that they're okay. We're going to check Achilles tendon down to the calcaneus. Any pain or anything there? Over here, we're going to check the Achilles tendon. There. Okay. For range of motion, we're going to go ahead and palpate them. Our metatarsals. Any pain? All the joints of her toes, each individual ticklish. And each toe, any pain or anything? No. And palpate over here, down each individual joint. No. And then for her ankles, we're just going to do a rotation in a circle, which will cover all the range of motions. And I think that concludes our musculoskeletal exam. Thank you.